Thank you. Next for an opening statement is Ms. Capps. Let me mention that once again she is the vice chair of this subcommittee, and deservedly so, since she's done so much work on healthcare, particularly on healthcare professionals.
Thank you, Mr. Chairman. I'm so pleased we are beginning our hearings in this Congress on health reform. It is clearly, in my opinion, the #1 issue this subcommittee needs to address. And as the President has articulated in his health summit and so many other places, our efforts at overhauling our nation's broken health system are really integral to our work in improving the economy. I'm eager to hear from today's witnesses about how we arrived at this point in the first place. Why does the United States, and we've heard a lot of documentation in the opening statement so far, with all of our innovation and our spending, why do we measure up so poorly against other industrialized nations? Why do we have such high infant and maternal mortality rates? Why do we have a lower life expectancy? Why do we pay so much more but receive so much less? Our next steps, of course, are how to address these factors that plague our healthcare system. I'm counting on a certain absolute, that in any solution we offer or pursue, we should bring and will bring prevention and wellness back into the fold as a core ideal. During the Bush administration particularly, there was very little attention given to the importance of prevention in health care. And because of that, our nation's public health infrastructure has suffered. We need a system that incentivizes primary and preventive care, not one that simply responds to chronic diseases and emergencies, often in the emergency room. We need a system that invests in our health workforce so that enough nurses, physicians, and a myriad of other professionals are available to treat people and to work with them. Not one that divests from medical and nursing education or cuts reimbursements. I'm glad to see this issue is on the agenda for future hearings. In closing, I just want to underscore the urgency with which we must address the current crisis. It is very real today in the communities we represent, in communities across this nation, in rural areas, and in the inner cities. And I very much look forward to hearing what our witnesses are saying today, and I yield back.
Thank you, Ms. Capps. And next,